It's coffee time here at Behind the Scenes 9 for 1 with me, your host, Dr. Suarez. And today we're just going to ask a really simple question. What in the hecking heck is even a cavity? I mean, we talk about it. We don't want one. Do we even know what it is? We talk about it all the time. We talk to our patients about it all the time. You talk to each other about it all the time. What are we even talking about? So I'm going to keep this really simple for you today. A cavity is a hole. It's literally a hole in your tooth. Now I know that's really simple, but think about it. It's a hole in your tooth. So if you wake up in the morning and there's a hole in your head that just spontaneously appeared there, would you not be concerned? Would you not want to know how it got there and how you stop it from coming back? I mean, who wants to wake up with holes all over their body that just randomly got there? Obviously something is wrong, right? So how does a cavity get there? You have bacteria in your mouth. So we're going to keep this really elementary. There are sugar bugs in your mouth. There are good bacteria and bad bacteria. And if you feed the bad bacteria, if you feed them sugar, which is what they eat, if you put a lot of acid in the mouth, which is the environment that they like to live in, if you don't brush them away, then that acid, that bacteria, it makes a nice little home. It kills all the good bacteria and it starts to melt away your outer layer of your tooth. So your enamel just gets destroyed because it's in an environment with acid where all the good bacteria is gone, where your saliva can't get in and do anything. The top of your tooth is melting away, now bacteria gets in your tooth and you have a cavity. And as this cavity gets bigger and bigger and bigger, because you don't even know that it's there, it starts going towards the center of your tooth, towards the more sensitive parts of your tooth. And that's when you start to have discomfort. So ideally, we want to not disrupt the home of the good bacteria, right, which is your mouth. We want to keep things really healthy. We want to brush the bad bacteria away. We want to minimize how much we're feeding the bad bacteria. I mean, it's like feeding roaches in your house. You don't want that. So minimizing how much we're feeding the bad bacteria that just eats sugar, right? Glucose. So anything that's broken down into sugar, that bad bacteria is going to eat. It's going to eat it, it's going to poop out acid on top of your tooth, and it's going to melt your enamel away. So ways to avoid it: make sure you keep your teeth really clean, try to stay on top of your diet, don't feed the bacteria, and also saliva is huge. We need to make sure that we have enough saliva and that our saliva is healthy. So what does that mean, saliva healthy? It has antibacterial factors in it, antifungal factors in it. It brings back the acid balance in your mouth to neutral, to normal, to the pH of water, very neutral. And it puts the calcium back in your teeth, so it helps remineralize, okay? So here's a good home care tip, all right? Most important time of the day for you to brush is at night before you go to bed. Why? Because you're brushing off all the sugar bugs, so now your teeth are really clean, and it allows the saliva to get the calcium into your teeth. It allows the saliva to neutralize the mouth, and it allows the mouth to have a good 7, 8, 9 hours of sleep where you're restoring the health back to your mouth, okay? So tip for the day is floss, then brush at night before you go to bed so that you give your teeth a fighting chance.